My name is Juliana Cox, and today I will be talking about team building. I've decided to do team building because I've always wanted the opportunity to explore team building. However, I've never really done it, so this individual presentation has given me the opportunity to explore on what I've always wanted to do. Team building are various activities undertaken to motivate the team members to increase their overall performance as a team. You can't just expect the team to perform on their own, so a motivational factor is a must, and team building activities consist of various tasks undertaken to groom the team members, motivate them, and make them perform at their best. Today I will be giving a brief history on what I found in literature and online. I'll also be talking about programs that have been introduced, the initiatives on like webinars, retreats. I'll also be talking about the history or the issues that I found in the scholarly literature and about the importance of leadership as well as the scholarly literature in general. Lastly, I'll be finishing off with my own opinion, and yeah. So over the years, there have been many approaches to help solve the issues that are related to teamwork or the lack thereof. The earliest information that I came across happened in the early 1930s. So with all units, it's important to work as an interdisciplinary team. However, in this article, the mental health field was finding more incidences of not working together in dire situations. These caused problems within the staff and within the patients and their treatments. So moving along, or quite along, in 1987, the Health Education Authority of London developed a workshop program which is set to encourage and enable teams to plan appropriately. So this model uses a problem-solving approach. So they work together in a workshop where guidance is needed for these teams in order to work together. So they give them that. And today, individuals, there are quite a few different techniques used depending on the organization. So the programs, I found many different programs and approaches. One of the programs I found focuses on leadership, the system support, as well as the patient focus. One of the most important things that I've found throughout the literature was that educating staff was a key to each of these programs. So one of them, the Homans model in particular, helps improve staff communication and interpersonal relationships. It addresses conflict and more directly. So this model allows for away days to be part of the program. So what away days are team building exercises that are accomplished outside of the office or hospital. So these could include whitewater rafting, volunteering, building, any of those types of things that will help the team click, so to speak. So each of these programs vary in lengths and sizes, and the size of the groups also matter as well. However, at the North Bay Regional Health Center, there are webinars available. In my placement, I've also noticed some. I've been able to listen into the leadership webinars, not necessarily team building. However, the leadership webinars focus on the way that other individuals approach their learning needs, and this could help the team building in the long run. So issues that I found in the literature, or it's important to explore the multiple generations. We have the veterans, or in this picture, the builders, who are getting quite older. They're needing help with like ADLs. They're dealing with their own issues, like their own medical issues. They're unable to work long hours because of their stamina. So the 12-hour shifts that they are to be working is extremely exhausting on these individuals. Mind you, there aren't as many as they are of the other generations, but there are still a couple. So moving on, we have the baby boomers who this generation just loves to work. This generation is also considered the sandwich generation. So as of now, they have their parents who are getting old, they're needing help with cooking, ADLs, pretty much watching them. But they also have their own children at home who are growing up and need help to be raised, right? So these older nurses, however, have a great deal of knowledge, and it's good for them, and they can be great mentors to the younger nurses that are wanting to become just like them. Moving on, we have Generation X. This generation has quite a bit of debt, and they may be caring for their own their own younger children, but the debt would cause them to want more hours, and they'd be working quite a few extra overtime, which in the long run could cause nurse burnout, which is not good. Moving on, we have millennials, and this generation is focused on the social life as well as work life. So they're very flexible with their schedules, and it is important that they are. So this younger generation is important as nurses because we understand the technology that is being introduced, because we are introduced to so many new technology within the system. So it's important to have them. And also, not only is the generations an issue, there are also genders. So males bond differently than females do. So away days are more effective for the male population. However, the females tend to benefit from the day programs and the retreats. It's also important to address the staff morale, because if the staff is unwilling to learn new tasks, the team building will not work as effectively as they would want. And managers must also value individuals not as the team, but as self, so as on their own. So in the scholarly literature, multiple of the studies have shown once completing programs, the staff reported their job satisfaction as well as better communication between the individuals. So not only does this impact their work ethic, but the staff no longer dread going to work because the team approach is used and more stuff can get done. So the weekly meetings, or huddles, have been proven to help interdisciplinary teams work well and get a better understanding of what is happening on the unit, and it's in a more in-depth report. So something that wouldn't be said in morning report could be said in the huddle. So it's very important to keep those in the system. Also, the way in which staff is treated is very important. So when it comes to working as a team together, if one staff member is favorited, there's normally envy or jealousy or rage towards that staff member. So working as a team with them would be near to impossible. Some of the barriers that I found was the time allotted to help train the staff. It was always hard to find because they're always so busy doing nursing work or clinician work or physician work. So these studies had to be done on their own time. So it was hard to find enough staff who wanted to do them on their own time, as well as resistance to change. So it's understandable that it's easier to do what you know rather than learn a new way to do things. So without them wanting to change, it was harder for them to accept the change. So, yes. So my opinion on the topic, in my preceptor placement, I've been able to see both positives and negatives with the teamwork. So on the mental health unit, there's been a new initiative that has been started with mock code blues, because there's been situations where code blue happens and the nurses don't really know what to do. So this initiative happens every 6 to 8 weeks now, and it's pretty much doing a mock situation of what code blues could be. So the first couple of code blues, there was very little communication. The teams didn't work well together. This has been a real situation, or had this been a real situation, the patient probably would have not made it, or had significant brain function, or a decrease in brain function because of the lack of oxygen that was being supplied to the brain, because the CPR didn't start until about 5-10 minutes after the situation started. So that being said, on the other hand, the more recent mock code blues had amazing communication. They worked well together. One of the individuals took the lead in the situation, telling or delegating where people should go, what they should do, how they should do it, and everybody just followed after. These situations in particular have taught me that the leadership is a key factor to having a great team, and being able to work well together. It's very important. Now, moving on with having a plan in mental health for any situation, like Code Whites, going in with a game plan before actually going into the situation is always important. So what they do is they meet up in the nursing station and they have a leader delegating tasks. So this person will do this person will do that. And that not only helps with the situation, but it helps with the safety of the patients, which is our main goal, right? So that's always important. Yeah. So in conclusion, no matter what the program entails, the group almost always improves their teamwork, whether it be outside doing activities or in a closed environment. The fact of working together improves work ethic and communication between staff. So thanks for listening, and I hope you have a great day.